Welcome back to the Easy Medical Learning. This is dedicated to the medical students for TCM. Today I'm going to be covering exterior releasing herbs. You will be seeing a slide with information, but I need to do an introduction. The exterior releasing herbs are basically herbs that are either warm in nature or cold in nature. There's two categories. It's either going to cover wind heat, wind cold, wind dampness syndromes, and summer heat syndromes. So these are the basically four things that would be covered pertaining to the patient, of course. It has nothing to do with the herb itself, but it does. If you notice, all of the items I said begins with the word wind. That gives you an understanding that this is exterior releasing. In general, this is a superficial level of a particular condition because the pathogen has not yet taken set in the person's body. It's very abrupt, and this particular syndrome, again, the pathogenic factor is on the surface. Here's another thing to consider. The exterior syndrome that one would have to have pertaining to these set of herbs, like I said, it's wind cold or wind heat, but the herb works in this manner. It releases the exterior, and for example, you'll have them where it's either warm, acrid, pungent. That will take care of the list of the herbs that are warm, acrid, and pungent. The other set of herbs is cool, acrid, and pungent. So that means if you have a patient that has a wind cold syndrome, they would certainly be using the warm, pungent herbs. On the other hand, if you have a patient with a heat syndrome or wind heat syndrome, it's going to be a list of herbs that are cool, pungent herbs. Most of these herbs, they are dedicated, or most of them is the lung or the bladder channel, or both lung bladder. You'll find that some of these herbs, it'll have other channels that it enters, but that is the main situation. So let's think. Some of the exterior releasing herbs, they will either relieve asthma in some sort of a way, resolve phlegm, promote measles eruption, disperse water retention, stop pain, and it can be used for treating asthma, poor measles eruptions, edema, etc. Again, but these are exterior releasing herbs, but they may have other factors of what I just said. You don't have to memorize this. I'm just setting it up for you. Another important factor when it comes to these particular herbs, it's diaphoretic in nature. That means it promotes sweating. There are some exceptions, but let's start. And I'm going to say it could also reduce fever, alleviate pain, relieves inflammation, and antibacterial and antiviral. That is a lot. Today, what we're going to do is we're going to do it in a very easy way. We're going to cover the wind cold syndrome. So therefore, that would have to be the warm, pungent herbs. We're only going to do a set of herbs at a time. There's going to be 2 herbs, and what I'm going to do is this. We're going to do Ma Huang versus Gui Zhi, and you'll understand why shortly. Thank you. Let me say this to you in general. Ma Huang is known also to inhibit your immune reaction. It excites your central nervous system. So therefore, this item is more or less, it reacts in your system as a stimulant because it does increase your blood pressure, and it also excites your central nervous system, as I said, and it also is a diuretic. On the other hand, Gui Zhi, which is, you should know this by now, it's a cinnamon twig. It more or less stops pain, it calms down, and it improves blood circulation. I'm just saying a few things so you could get the idea that basically these 2 particular items have an opposite effect, even though they're in the same category of exterior releasing herbs, and they're both warm in nature, but it depends on in which way. I said that earlier, 2 types of herbs that releases exterior are warm, acrid, pungent herbs, or they're cool, acrid, pungent herbs. You need to know this. Ma Huang is for wind, cold, excess. Gui Zhi, on the other hand, is for wind, cold, deficiency. Exterior releasing herbs, very important to memorize. They're for wind, cold, wind, heat, wind, dampness, and summer heat syndromes. These are all syndromes, and if you notice, wind is right in front of them, in front of the words. As I said earlier, it covers the lung and the bladder channel plus more, but that is the main channel that these herbs go through. The use of exterior releasing herbs is for the treatment of superficial level. The pathogenic factor, attacked by the pathogenic factors are through the nose, mouth, skin, and pores. The area of the body that the pathogen affects is typically the skin and the muscle, and the onset is abrupt and is typically for a short time. When you're taking the test, it is described as a person with a wind cold, wind heat, wind dampness, or summer heat. That'll be a clue that you're dealing with some herbs that has to deal with exterior releasing. In fact, I'm spending a lot of time with this because these are the chief herbs that in my vision you need to know well. So a lot of time is going to be spent on this, and you'll understand why, because typically these are what makes up the formulas. On the test, this is very important. If the patient is sweating, that typically would resolve the issue. So no treatment is necessary if the patient is sweating. However, if there is sweating and no change has occurred with the condition, then you need to use herbs to release the exterior. We're going to go through the herbs step by step, but I want you to pay attention to this. Ma Huang, the patient has no sweating at all. Gui Zhi, the patient does have sweating. This is chiefly important. Both Ma Huang and Gui Zhi, they go through the lung and the bladder. Gui Zhi goes through the lung and bladder and the heart. Now, this is going to come to a situation where you have to understand that if you have a wind-cold syndrome and the patient has sweating, you put Ma Huang and Gui Zhi together. If you have a wind-cold deficiency, you use Gui Zhi Tang. When you're putting the Ma Huang and the Gui Zhi together, it's because you're trying to balance out the patient. So that's why you use the two herbs that has the opposite situation with the patient, because one patient, one is sweating, one isn't sweating. But the two combination of these herbs will balance each other out. And when you're dealing with deficiency with the exterior releasing herbs, it would be wind-cold deficiency, Gui Zhi Tang. As I said earlier, most of these herbs has a diaphoric effect in the exterior releasing herbs. Let's look at Ma Huang. Ma Huang is pungent, warm, slightly bitter, goes through the lung and bladder channel, and it does induce sweating because remember, the patient is not sweating. With Ma Huang, that is wind-cold syndrome with no sweating. If you have wind-cold excess syndrome, that is the time that you're using Gui Zhi and Ma Huang for Gui Zhi Ma Huang Tang. Please note what I have in front of you on the screen. I'm going to put it to you in a nutshell. It induces sweating, Ma Huang, and releases the exterior. It disseminates lung qi. That means if you have some kind of obstruction. Also, it promotes urination and reduces edema. You could use Shenjiang, Beizu, Yubu, Je, Zui Tang. Take a look. It's right there in front of you what you could use. If you want to correct the situation for the lung obstruction, you're going to use Ma Huang, Shen Ren, as in Shen, Ah Tang. Please take a look at the screen. It's right in front of you. These are the contraindications or the cautions for the use of Ma Huang. If the patient has hyperthyroidism, hypertension, angina, picturis, and insomnia, those are the caution. And I said earlier, also it affects the immune system, but these are the main chief things that you need to know. Now let's look at Gui Zhi. Again, Gui Zhi is a cinnamon twig. Keep in mind that this particular herb in the list, and I'll show you this shortly, look at it this way. It helps women when they have a situation dealing with their menstruation. Dysmenorrhea, that's when they have the painful cramp, or amenorrhea, that's when they don't have or absence of menstruation. So think of Gui Zhi, that this is something that's considered for females because there's a list of things that it does regarding females. Gui Zhi is the lung, the bladder, and the heart channel. Is pungent, sweet, warm. Again, the patient in this situation is sweating in the exterior releasing herb. the patient is sweating. Gui Zhi also covers the B syndrome, abdominal pain, dysmenorrhea, we covered that already, from cold that causes blood stasis. In general, for purpose of the test, Gui Zhi is typically used with Ma Huang to warm yang. Gui Zhi is also used for edema due to kidney yang deficiency. Notice that Gui Zhi helps out with deficiencies of yang. Also chest pain leading to blood stasis, palpitations with shortness of breath, heart and spleen yang deficiency. Please note, these are deficiencies with yang, water retention, and palpitation with arrhythmia due to heart yang deficiency. I'm just giving you a hint. Most of these things that Gui Zhi would be memorized for is for deficiency pertaining to yang. Please take a good look at the slide again. Again, Gui Zhi is typically used in situations dealing with yang deficiency. I just said kidney deficiency, and I said heart yang deficiency, and spleen yang deficiency. You don't have to memorize every single thing. I'm going to show you how to learn this and how to memorize this. This is Ma Huang versus Gui Zhi. Both of them induce sweating and releases the exterior, but with one situation, the patient is not sweating. That is the one for Ma Huang. When the patient is sweating, you would think of Gui Zhi. Both Ma Huang and Gui Zhi, they have the following conditions, but they're for different reasons. They both have edema conditions. But when you're going to use Gui Zhi, it's edema from kidney yang deficiency. Are you noticing that I'm highlighting the deficiency is when dealing with Gui Zhi? The other one, it helps to promote urination. The edema is because of it requires the body to promote urination. So you're going to use Ma Huang from exterior conditions. That is why the person is in that situation. Here are the cautions for Gui Zhi. The cautions are the contraindications. If the patient is warm and has a febrile disease, because remember, the list that I'm focusing on is the warm exterior releasing herb. So again, if the patient is warm, you wouldn't use it. A deficiency in yin with heart signs. Bleeding due to heat in blood, or a pregnant woman, or menorrhea. That's when a female has her menstruation. These are the chief important cautions or contraindications for Gui Zhi. Let's go over this again. The caution and contraindication for Gui Zhi. If the patient is deficiency with yin, with heat signs, because again, the herb is warm in nature, or if there's a bleeding due to heat in the blood, or if the patient is pregnant, of course, a pregnant woman, or menstruation. These are the times that you cannot prescribe or consider Gui Zhi for a patient. And again, like I said, most of these things, it refers to females because it deals with menorrhea, which means menstruation. Guys, by now you should have memorized these features regarding Gui Zhi. Gui Zhi, you could look at that as for cinema twig. It deals with the heart because it goes through the lung, the bladder, and the heart channel. In addition to that, is for a pain condition, and that's where you have the B syndrome. We already talked about female issues, and the edema is due to kidney yang. And the blood stasis, that would be dealing from chest yang deficiency. Most of the things, like I said, with Gui Zhi, it deals with deficiency. That is how you should look at it. And another thing, it does induce sweating, the function of the herb, and it does release the exterior. And it does warm and unblock the channel. And it basically warms yang. Guys, I just said that the herb, it does induce sweating and it's releasing the exterior. But remember, with this particular herb, this is a good key test question. The patient is sweating. So the patient does have sweating already. This is very important. This is for wind cold also. It does induce sweating, but the patient does have it. The patient is with sweating or has sweating or some sort of a sweating. It's typically for wind cold deficiency syndrome. Gui Zhi is for wind cold deficiency syndrome. Look at it that way as well. On the opposite end, you should have memorized that Ma Huang goes through only the lung and the bladder channel. This patient is not sweating at all. It does induce sweating and it releases the exterior. And this is wind cold excess syndrome. Very important so you could distinguish the two. The way that I'm showing you, you're going to memorize this information so easily. Please take out your time to click the like. If you found this video interesting and helpful and useful, come back and join us again real soon. I'm encouraging you also to leave a comment in the comment section. And you can just describe what you thought about this video and where you think I could improve or where you think that I'm doing a great job. If you're not involved with herbs, as of yet, you're doing it from a point of view of learning, I'm showing you the easiest way because I am involved with herbs very heavily. I think you see my name there. I'm an acupuncture physician. I graduated from a school here in Florida. And I love being an acupuncture physician. And I look forward to helping you to acquire your license.